Dr. Lang, what are some of the manifestations of autoimmune disease?
Well, it can present in almost every possible way. Almost any of your patients, doctors, could be coming in with an autoimmune disease, whether it's a classical one or not. I mean, there's obvious autoimmune diseases like asthma, eczema, Crohn's disease, and that you'll automatically think autoimmune. But what if somebody presents with a foot problem, with a low back problem, and that's their main problem? You have to keep that in the back of your mind, look for more obvious things first. Let me give you a few examples. Somebody comes in with a low back pain, and you rule out a disc, you rule out, there's no history of trauma or anything like that. So if you're savvy enough, you'll figure out that they possibly have facet syndrome, which is a very common form causing a pain either across the back or more on one side. And that the etiology of that is from adrenal stress, and then you have to find out the etiology of adrenal stress. So, very common, they have an autoimmune disease, and most common it's one of two types, triggered by two types of viruses. Either it's Epstein-Barr, chronic fatigue syndrome, or Coxsackie, chronic fatigue syndrome. And you have to fix that, otherwise the adrenal stress will very often come back even after you fix it. Adrenal stress causes the gluteal muscles to be weak, and you wind up with a pain in the low back. So you have to fix that, and it goes through a whole series of steps to do that. That's one example. Another example is sort of an autoimmune disease, but mercury toxicity. That will cause some muscles in the foot to weaken, and the patient will come in with a foot problem, maybe chronic ankle sprains or any type of foot problem. It's really the tibialis antegus muscle that's weakening. That's an interesting thing. We're going to talk about it some other time, how mercury problems cause this problem, and you actually see cogwheel rigidity, which is an upper motor neuron lesion. Leave you with these thoughts today.
Thank you.